I'm joined by Dr. Tariq Alam, Head of Medicine Department at the Bangladesh Medical College Hospital. Appreciate your joining us, Dr. Alam, here on India Today. You are heading the team of medical experts involved in this research on coronavirus. A lot of excitement when you and your team now seem to have suggested that you have found a combination of drugs that can possibly treat coronavirus. Tell us, what is this combination? How exactly do you believe this will work?
The combination is ivermectin, which is an anti-protozoal drug which we have for at least 35 years. We have been using it for scabies and head lice. And the other medication is doxycycline, which is there for at least more than 50 years. So the anti-protozoal drug has antiviral properties, which was shown by a study in Monash University in Australia. And the paper came out in April 3rd, I think. And doxycycline is a part of tetracycline, which also has antiviral properties and immune modulatory effects. So here in Bangladesh, we had a few patients who were not agreeing to have hydroxychloroquine and azithromycin, which has cardiac toxicity. So at that time, we offered them this combination.
Right.
And eventually they tested negative in 5 days. So after that, what happened, we had, in our medical college, we had Indian students who had to be evacuated.
Right.
So they had the date of evacuation, but before that, 3 of the students became corona positive. So without a negative certificate, you cannot fly. So when they approached me, I gave them this combination. And because the flight was in 7 days, this time I rechecked with the help of the government agency in 4 days. And in 4 days, we found that they were negative. And they didn't have any symptoms. And as my hospital is not a COVID hospital, we don't have any admitted patients, but we had patients who were positive and had mild symptoms.
So you're claiming that in 4 days, using this drug combination, you were able to neutralize the COVID symptom. Now, you say you've achieved success with these students that you use with this combination of drugs on, but the big question, are you in a position that you can actually work this on a large scale, doctor?
Not only students, after that we actually used the medication on patients and relatives of the patients. They were in COVID infested area in Dhaka, and we had 100% success rate. All the 60 patients we gave the medication had relief of symptom in 2 to 3 days. The fever was gone, the diarrhea was gone, the cough was decreasing, and they became negative in 5 to 7 days because we couldn't test after 2-3 days. But they have become negative.
But Dr. Alam, is the plan to scale it up in Bangladesh? Is that what you've decided, that this combination of drugs now will be widely used for coronavirus patients in Bangladesh? And do you believe, therefore, this could be something that other countries could also try?
No, not yet. I think we need at least a trial, a randomized control trial with hydroxychloroquine and azithromycin before the government gives a go sign for using it randomly.
But you know, the question, doctor, is that doctors across the world at the moment are looking for a combination of drugs till such time as a vaccine is found. Are you reasonably confident that within a month or two, you or indeed other doctors will be in a position to have that combination of drugs that can treat coronavirus?
I am reasonably confident, yes. Within a month, within a month we would be having this combination for treating coronavirus. But we have to start it early. In the early part, in the first 7 days of symptoms, we should start that.
But you know, in all these cases that you've used these drugs, I'm going to flash some of the information you're giving us. Were the patients basically having mild symptoms, or were they in a critical state?
3 patients were in a critical state, and they didn't want to go to the government hospital, and so they went home with the medication and they improved. 3 patients only, because we don't have this hospital in our college. Other patients were asymptomatic and had mild symptoms.
In conclusion, doctor, what's the next step? Are you going to, as I said, be starting some trials that will be conducted over the next month? Has the Bangladesh government given you permission now to conduct trials on a larger scale using these combination of drugs?
Yes, I just had a meeting with the health minister this morning. They have given a green signal, so I have to just submit a study protocol, and I think we'll go for a larger trial with 300 to 400 patients.
Very, very interesting news coming in there from Bangladesh. You are claiming that you may well have found a combination of drugs that can cure COVID within 4 days. Dr. Alam, that you've taken out the time at a time like this. Thank you very much. Eid Mubarak to you also there in Bangladesh.